A hernia, just globally by definition, is a rupture. And usually we mean it in the abdominal pelvic wall, commonly in the groin, called an inguinal hernia, either congenital, something you're born with, children or young adults. Under 50 is a young adult. Don't qualify there anymore, and as you get older, a direct tear in the pelvic wall. So a bulge forms through which bowel or other internal organs can occur, can push through, causing discomfort or potentially injury to those organs. Inguinal, groin most common, followed by umbilical hernias. People always have family or friends whose belly buttons bulge, which can have symptoms or no symptoms. Incisions, anytime an incision is made in the abdomen or pelvis, that incision is never more than about 80% as strong as it originally was. So that can bulge with time, particularly if you have risk factors for any hernia, such as a family history, chronic coughing or smoking that repetitively stresses it, constipation, difficulty with your bowels or passing your urine, prostatism, or a lot of on-the-job stress that can weaken those tissues. It's usually either no symptoms if the bulge occurs away from a nerve, or some symptoms. There is not a direct correlation between the size of a hernia and the symptoms. Very small hernias, if they bulge over the nerve, can cause significant discomfort. Conversely, a large rupture, if it occurs over time and the body adjusts, very little, if any, discomfort. Also, there's a misunderstanding that the size of the hernia reflects the seriousness. Actually, a bit conversely, some of the smaller hernias are more dangerous because the bowel or other internal organs can slip in, swell, and can't come back. Conversely, a large hernia, the organs can slip in and out and are less likely to get injured. Somewhere, in terms of the incidence, about 10 to 12% of men and 6 to 10% of women in their lifetime will develop a hernia rupture and be referred. If you came and saw me, 6 weeks, minimal discomfort, you can push the bowel back in. So when you're bothering you, we do it on an elective basis. Elective surgery doesn't mean unnecessary. It just means you pick a place and time of your convenience, an optimal condition, to have elective surgery and go home the same day in most cases. So it has to fit into their life. If you just had a heart attack and your hernia wasn't bothering you, obviously, that's a priority. Conversely, if you're you're older and it's not bothering you, so it's elective. It's necessary. You pick a date and time of your convenience. The risk of that bowel being trapped in a hernia, an inguinal hernia, umbilical hernia, is 1 or 2% a year at most. It's low, but it's not zero. So if people are expected to live for several more years, it's a little bit symptomatic, they're healthy enough to have surgery, frequently under Novocaine and sedation, then we would recommend repair for that small risk of damage to the organs, but really to make them feel better. Part of the discussion about it is, of course, what is it? Do you need a repair? How urgent is the repair? And the different approaches. The most common would be the inguinal. And we fix them either with an open approach, anteriorly, dropping sutures or mesh. Mesh is pretty much the standard now because it's kept the risk of recurrence to the low single-digit risks. The other approach, an anterior approach, is a laparoscopic approach. And I'll fix about 1 in 5 or 6 hernias laparoscopically. And that's a nice approach. That's general anesthesia rather than local sedation. It takes a little bit longer, but it gives you a beautiful view of any potential hernias in the future. You can look at the other side. You can put a larger piece of mesh in, and it probably hurts a little less for the first 3 days. At a week, there's no difference. But it takes more time, greater cost, and the published recurrence rate is a little bit higher than open surgery. Recovery is such an individual thing. If you work for yourself, you're in the office the next day. If you have 6 weeks of sick time, you're back in 6 weeks. So. But either way, local sedation, anterior, laparoscopic, really the 3 days of rest at home. You don't drive, you don't shower, you don't hug your wife or husband, you just relax for 3 days. And that's a big part of the recovery. And most people are off serious analgesics within 3 days, often less. This is for inguinal umbilical. Ventral or incisional hernias, much bigger deals. More fluid shifts, longer recovery. Whenever you operate on the core, it takes time since you have to use that for all your activities of daily living. So you can kind of double the recovery rate for ventral hernias. All hernias are not alike, but it's a fairly rapid compared to other operations like certain joint replacements and things like that. So